Hello, I decided to do my project on amyotrophic lateral sclerosis, also known by the acronym ALS. ALS is a progressive neurodegenerative disease that affects nerve cells throughout the body. The disease may start off with barely noticeable symptoms such as muscle weakness, difficulty with motor tasks, and clumsiness. However, as the disease progresses, it attacks more important nerve cells, ones that control, for example, chewing, swallowing, and eventually breathing. Most patients with ALS will die within 3 years of diagnosis, and almost all of them will require mechanical ventilation at the end of their lives. Signs and symptoms include those I mentioned above, difficulty with muscle groups, including those that control important bodily functions, and symptoms usually start later in life in the patient's 50s or 60s, and it does appear that the disease seems to target men more than women. About 10% of all cases can be attributed to genetics, but some other causes include autoimmune response, accumulated exposure to toxins, and gene mutations. The nurse plays a unique role in the treatment of ALS. This includes performing range of motion exercises with the patient to keep the muscles flexible, frequent skin assessments, and encouraging the patient to try to perform daily activities to the best of their ability. The nurse should also assess the patient's ability to void independently and utilize tools to prevent the accumulation of moisture on the skin, as this can lead to skin breakdown. The nurse should encourage fluid intake if the patient is able to swallow without risk for aspiration. The nurse should assess the patient for malnutrition as well. Ideally, the patient should be consuming a diet that is high in carbohydrates and protein, and hopefully will be able to maintain a normally textured diet. However, as the disease progresses, the nurse will need to revisit dietary orders, as the patient may have difficulty consuming normally textured foods. Eventually, the patient will likely need PEG tube placement, in which case the nurse must frequently assess the insertion site for signs of infection, and also frequently check residuals to be sure the patient is absorbing the tube feeding correctly. As it regards respiratory status, the nurse should assess chest rise and fall, and should note symptoms of air hunger in those with advanced ALS. This may present as gasping, use of accessory muscles, or low SpO2 readings. Eventually, the patient will likely need mechanical ventilation, so the nurse should have a thorough understanding of the mechanical vent, its purpose and indications, and signs that it is either too effective or not effective enough, which will be indicated by arterial blood gases, for example. Finally, the nurse should be aware that this diagnosis will have an enormous impact on the patient and their mental health. Therefore, the nurse must listen to the patient, accept their fears and worries, and advocate that their personal wishes be met. The nurse should also not hesitate to recommend a psychological consult for patients who appear to be in need of one. Thank you.